طلابنا الأعزاء السلام عليكم ورحمة الله وبركاته. Today I am Dr. Huda. I will speak with you about an important topic in embryology, that is teratogenesis. Teratogenesis in Arabic means المسببات للتشوه. It is a very important topic as many babies are born with many abnormalities or defects, and you have to know something about what can cause these defects. If you want to come to know what is teratogene or how we define teratogene, so teratogene means any agent that's chemical, physical or radiation that can alter the fetal morphology or during the embryonic development, or it can also change the fetal function if the baby is exposed during a critical period of development. So it is an effect of that agent, well, whatever it will be, whether it is chemical, physical, radiation, or something in the environment that the baby is exposed to, and to alter the function. Most of cases of as a causes of congenital anomalies or abnormalities of the baby at birth, most of these cases are multifactorial or unknown factors, which occurs in about 70% of cases. الغالبية العظمى من الabnormalities due to unknown causes, environmental causes maybe, and about 20% of other cases they are due to genetic causes, that is maybe transmitted from families, from father, mother, the offspring, of course, during gametes at time of fertilization and further development of the embryo in utero. About 10% of cases are due to environmental, and these environmental causes may be caused by due to عدة أسباب بالمحيط اللي يحيط البيبي development. Most of about 2% of these cases could be due to infectious agents, certain infection which occur during pregnancy while the mother is pregnant. If she exposed to that infection, التهابات ممكن تكون by viral agent, bacterial agent, that these infection can cause as a sequelae or as a complication, it can cause to congenital abnormalities in 2% of cases. Other 2% may be cause of these abnormalities by maternal diseases, maternal condition. Certain maternal diseases are, for example, diabetes, thyroid, epilepsy. Thyroid and diabetes can affect the development, and they can cause congenital anomalies by the condition themselves. While the epilepsy, for example, the mother with epilepsy will be in a condition of repeated seizures, attacks of seizures, نوبات صرع, and definitely she will need to control these seizures during a pregnancy. She need of taking drugs, and these drugs, most of the conditions, these drugs can cause congenital abnormalities. So being carefully the selection of these drugs during a pregnancy, and you select the least probable drug that can interfere with the fetal development and causing abnormality. Drugs and chemicals, 5% of cases. Okay, and we will speak on what these chemicals and what these drugs can cause such abnormality. Ionizing graduation is another factor that can cause maternal or fetal maldevelopment or genetic defects or abnormality in 1% of cases. One can ask, are all embryos in utero, when they expose to certain teratogene, can have a birth defect or abnormality? The answer is no. Why? Because there are certain factors that they act in combination or in single combination, they can affect this condition. One of these factors is fetal factors due to itself, the fetus itself. For example, if the baby in utero exposed to that teratogene in the pre-differentiation stage, that is at the time of fertilization to 7-day gestation, most of time there may be certain fetus will have death in utero, others will have no effect. So it is the fetus ability itself may determine that condition. Other thing, that if the baby exposed in utero at the differentiation stage between the 7-day and 57-day post-fertilization, sometimes if the baby exposed to that teratogene, they will end with malformation. Malformation that, for example, the heart may be developed properly, but there will be malfunction due to functional abnormality of the septum or the valves. Is it clear? Or if the exposure was occurring at time of post differentiation after 57, nearly about after 8 weeks development, in that condition there may be functional defect in the function of that area that will be affected. For example, when there is after 8 weeks, there may be certain defects that affect the heart function defect, or sometimes there will be growth retardation of the baby. This is one factor regarding the fetal factors. Other factors may be genetic susceptibility. There are certain diseases and certain families that the genetic susceptibility to certain diseases runs more in certain families. يعني أكو عدة عوائل عندها استعداد وراثي ممكن ينقل هذا عن طريق الأجنة through families and through generations. It can run from certain families, can run to other families that can affect the growth of the baby in utero. Others are, and of course, this genetic susceptibility different with different species difference and individual difference. Okay, and other factor that affect or that determine the effect of teratogene is the length and route of administration of a teratogene. Definitely, if the time of exposure was very minimum and the dose is very small, definitely the effect will be in a different way from exposure to a large volume or large quantity over a long time. So definitely the general effects of teratogene, as I said before, will be in the form of immediate action in form of death and miscarriage, or maybe the baby will be formed with malformation or with functional defect, or there will be a delayed effect in form of carcinogenesis or mutagenesis. What is the difference between the carcinogenesis and the mutagenesis? Mutagenesis is that change that occurred due genetic change due to that factors, and that process whereby a defect or genetic defect will occur as a result of that factor. But the carcinogenesis is the tumor development due to that effect of mutagene that had happened. What agent that can act as a teratogene? Or let me talk about types of teratogenic agents. These agents can be infectious agents, and these could be viral and non-viral. Viral as rubella, cytomegalovirus, herpes virus. Could be non-viral such as toxoplasma, or maybe spirochete of syphilis. Maybe maternal diseases such as I said before, maternal diabetes as a disease that can cause abnormality, epilepsy, phenylketonuria, or maybe chemical agents, especially organic mercury, الزئبق العضوي, phenol, and lead, الرصاص. Phenol, they are present in many منظفات and solvents, so they are example of chemicals that can cause a teratogene. Lead also. The drugs as tetracycline or sodium valproic acid, as I said, in use in the treatment of epilepsy. Maybe radiation such as unexplained exposure، يعني واحد يجوز يكون يشتغل أو عايش وسط the radiation but we cannot expose or we cannot explain the proper exposure. Maybe sometimes radiation that can be used in diagnostic or certain therapeutic procedures, they have also can be a teratogenic agent. So it is very important and always that you keep a note when the mother is exposed to a radiation, be always asking about her last menstrual period, آخر دورة شهرية, because there is a possibility of pregnancy and there is a possibility of teratogene. Also smoking, alcohol use, maternal hyperthermia. By hyperthermia يعني ارتفاع درجة حرارة الجسم. It is said that sustained maternal hyperthermia more than 38 centigrade, between the 4 and 14 weeks of pregnancy rather than spikes fever is supposed to be teratogenic. يعني sustained، يعني مو بس انه تكون تعلى وتنصى but sustained hyperthermia. That's why quite a lot babies and of pregnant women, when they exposed during first early time of development, especially during the first 14 weeks of pregnancy, if she get fever for a reason or so, such as for a flu, for example, common cold or flu, there is sustained hyperthermia. It can result in teratogene and fetal abnormality. Table, I just want you to show you how the fetal exposure dose of radiation by many procedures used in medical part, whether taking chest x-ray, abdominal x-ray, intravenous paleography, mammography, hip film, barium enema or small bowel series, CT scan or chest scan or lumbar spine CT scan, pelvimetry CT, all these are radiological procedures that the baby, if the mother is pregnant, are exposed to radiation. And in the other column you can see the fetal exposure, how with each procedures, just to keep how these, because we will now explain what occurring with the radiation when the baby is exposed and what is the dose that can cause a teratogene. It is said that radiation exposure in pregnancy, the safe dose is if it is less than 5 rad, because any increase in the radiation exposure to more than 10 rad, especially between the 10 and 17 weeks of pregnancy, can cause mental retardation and microcephaly, so they are mainly affect the CNS of the baby. So better, if there is no urgent release or urgent request for x-ray to be taken during pregnancy, it is better to be delayed or avoid after 17 weeks of pregnancy. Some others may say that radiation, if it is less than 10 rad, may affect the baby in such a way. Others may give up to 10 rad. So it is very important to keep a calculation of the dose of the radiation when the baby is exposed in utero to radiation. As I said, there are tables with each procedures, how the dose are reaching the baby to what limit. So it is very important to note that, because it is said that if it is above 25 rad, for example, that may affect certain abnormality of the baby, may affect the growth. There may be IUGR, intrauterine growth retardations, structural abnormality, or genetic malformation. So keep in mind that there should be always, you keep the dose which will expose the baby to that radiation. So all the abnormality, maybe there may be a risk of leukemias or malignancies occurring. Malignancy, there is some say that every 2 rad additional rad baby exposed to, there is increase in malignancy risk from 3.6 per 10,000 to 5 in 10,000. So it is very importantly to know what's going on. There may be also risk of gene mutation if the radiation is exceeding the normal safe limit. Definitely, the alcohol consumption also can have some bad sequelae on the growth and development of the baby. They can affect the baby in form of abortion, or can cause stillbirth and death. Miscarriage, abortion, it means miscarriage. This is the old term called abortion. Now they call miscarriage يعني الإسقاط أو الطرح بالمعنى العام. And the stillbirth, dead, يعني the baby is being born dead. We call it stillbirth. And it can cause fetal alcohol syndrome, mental retardation, IUGR, intrauterine growth retardation or restriction, or abnormal faces. It is said that if the mother exposed a certain limit of drinking alcohol, the baby will have different features, facial features called fetal alcohol syndrome. That the baby, they have definite maxillary ridges, and there is hypertolerism, that's the area or the nasal septum and the area between the two eyes will become wide, and the face is square-like shape. This is maybe because of the alcohol toxicity. And some others say that maybe ocular joint or cardiac anomalies. Definitely the same occurs with smoking. Smoking so far, because the smoke containing carbon monoxide and cyanide also, so they can cause growth rate restriction and preterm labor يعني ولادة قبل الأوان. They can cause partial separation of the placenta. They can cause physical and mental retardation or long-term effect as a teratogene to the baby. When you use any drug in pregnancy, you have to keep in mind what type of drug that drug is. The FDA منظمة الدواء والغذاء الأمريكية have categorized or صنفت الأدوية which are used during pregnancy into many types: class A, class B, class C, class D, and so on. The safest drugs which are usually used during pregnancy are class A and class B. Class C may be used. تشوف انت مثلا شنو الفرق بينها. Class C, the animal reproduction studies have shown any adverse effects on the fetus, and there are no adequate human studies. But in which case you use category C if you balance the situation between the benefit and the bad things to the baby. If the benefit is more, only you should use it. But usually we didn't use category C drugs. These are the remaining class D and X category, and you should keep in mind that category X drugs are of no, they should be forbidden from use, because you can see there is positive evidence of human fetal risk based on the adverse reaction from investigation or marketing experience. And under these categories, many drugs are there. For example, anti-cancer drugs, they are the category X drugs. They shouldn't be used. Drugs used by certain addicts, as the lysergic acid by diethylamide or marijuana, they are not shown to be teratogenic. Caffeine is also not a teratogenic drug. Last, stay safe at home, and thank you.